to another episode of our podcast, Nothing in My Brain. I'm Olivia.
I'm Joey.
And for today's episode, we're going to be discussing neurodegenerative disorders. So these are a group of diseases caused by progressive neurodegeneration, which is basically the loss or death of neurons, and it affects more than 50 million people worldwide. And so there are different risk factors for these diseases, and a big one is age, so it's more likely to occur after age 65. And then genetics also play a role. Some of them are linked to certain genes, and you might inherit certain mutations. And then environmental factors also play a role. So apparently lower vitamin D levels is associated with dementia. And then habits like smoking or drinking also contribute to it. So it's important to keep a healthy diet. And then an important thing to note is that all of these diseases are incurable. So while there are medications that help alleviate symptoms, they don't actually reverse the underlying neurodegeneration, which we'll go into later. And then, another thing is that these diseases are usually diagnosed through blood tests and also certain scans like CT scans, which use X-rays, PET scans, which use radioactive tracers, and MRI scans. And so there's different categories of these diseases. So the first one is dementia type, and we're going to be talking about them all. And then there's also demyelinating diseases. These are diseases that damage the myelin sheath. There is Parkinson type, motor neuron diseases, as well as prion diseases.
Right. So Alzheimer's is the most common cause of dementia, so about 60 to 70% of dementia cases. And it's basically a biological process where there's a buildup of proteins in the form of amyloid plaques and twisted fibers called neurofibrillary tangles in the brain. So this causes the brain cells to die over time, and eventually the brain shrinks. So the earliest symptoms of Alzheimer's is when people have trouble remembering recent events or conversations. And over time, the signs and symptoms of this gets worse. So the first affected part is the memory. So they would often repeat statements or questions over and over. They'd forget recent conversations, appointments, or events. They'd misplace items. They'd get lost in places that they travel frequently. They'd forget the name of their family members and everyday objects, and they'd have trouble finding the right words or expressing their thoughts and having conversations. So also they'd have trouble concentrating and thinking, especially with abstract concepts like numbers and math. So they also have as it progresses, they'd have difficulty making their own decisions, that's logical and sensible for them to make. So they'd wear the wrong clothes with the weather. So if it's a hot day, they'd still wear a jacket, and you'd what are they thinking? But it's because they have trouble making logical decisions, and they won't know how to react or make decisions in an emergency. So when they're driving or when there's a fire, they'd have trouble dealing with that. So this can be dangerous to the person, so they shouldn't be able to live alone necessarily. So you should react when you find out about the diagnosis immediately. And so they also have difficulty maintaining their routine activities. So brushing their teeth, changing clothes, bathing, things like that. And then they'd have a change in their personality and behavior. So they'd be depressed, they'd be more socially withdrawn, they'd have mood swings, they'd have anger issues, wandering, and basically delusions.
Yeah. It's one of the dementia type diseases. Right. And so despite this though, some people with Alzheimer's still retain certain skills. For example, it can be reading, telling stories, singing, music, dancing, drawing, stuff like that. For example, I'm sure some of you guys have probably seen videos of there's this ballerina with Alzheimer's, and then she could still kind of remember the dance moves. And so a little bit more about the hallmarks of Alzheimer's disease. As Joey said, it's the plaques and the tangles. And so basically these plaques cause mitochondrial dysfunction, oxidative stress, and also neuroinflammation. And so kind of how it works is that these plaques interact with redox metal ions, and then this basically catalyzes the formation of reactive oxygen species, which are basically highly reactive molecules, and they damage the cell's DNA, RNA, and basically just disrupt its whole function. And when you have a bunch of these ROS or free radicals, and the production exceeds detoxification, it causes oxidative stress. And then as for neuroinflammation, these plaques also cause a sustained immune response in microglia, which are basically the immune cells of your brain. And so sustained activation causes them to continuously release cytokines, which are these pro-inflammatory proteins, and these damage the neurons. And then also if you compare like an Alzheimer's brain, like if you're doing some sort of imaging scan, you can kind of see the difference between a healthy brain and a brain with someone with Alzheimer's, because they have atrophy in certain sections, so it's shrunken. And also an interesting thing is excitotoxicity, and this might play like a role in the progression of Alzheimer's, but also other neurodegenerative diseases such as ALS and Huntington's, which we'll talk about later. But this is basically excessive glutamate signaling, and when you have excessive glutamate signaling in the brain, it causes calcium overload, and this triggers a bunch of enzymes that lead to like apoptotic pathways and other damaging effects. And so for treatments for Alzheimer's, there's certain medications that patients can take. And so one of these is cholinesterase inhibitors, which basically increase the amount of acetylcholine, and that's depleted in Alzheimer's. And there's also memantine, which is an NMDA, or a glutamate receptor antagonist, so it's kind of preventing that excitotoxicity. And something important to note is that you can't really diagnose Alzheimer's when someone's alive. So doctors can only diagnose probable Alzheimer's, but you can only have a real diagnosis after death, when they can see, like, cut open your brain.
So we're going to talk about Parkinson's disease next, which is a movement disorder of the nervous system that worsens over time. So the nervous system is basically a network of nerve cells that controls like parts of your body, including movement. And so symptoms usually start slowly and then they gradually get worse over time. So the first symptoms in a person would be a faint tremor in a hand, foot, or their jaw. And in the early stages, the face usually shows little to no expression. The arms maybe don't swing when they walk, and their speech is either soft or slurred. So these are usually like common symptoms, but also you could have loss of automatic movement, so blinking and smiling. Your speech patterns may change. Your handwriting may change because of your fine motor skills. And then there's also depression, anxiety, and sleep problems.
Mm-hmm. And then, as you said, like the tremors, a common one is pill rolling, so it kind of looks like this. And another symptom includes bradykinesia. I think you said it, like slowed movement.
Right.
And so Parkinson's patients usually have like low levels of the neurotransmitter dopamine in the basal ganglia. And this is because there's basically a death of dopamine neurons in the substantia nigra, which is in the basal ganglia. And then it also might be linked to a deficiency in the neurotransmitter norepinephrine. So basically there's some degeneration in the locus coeruleus, and norepinephrine regulates blood pressure, and low blood pressure is a symptom of Parkinson's. And so some of the hallmarks of Parkinson's disease include the presence of Lewy bodies, and these are basically abnormal clumps of proteins. And in Parkinson's, they contain alpha-synuclein, and it occurs in a clumped form that cells cannot break down. And then as for treatments for Parkinson's, most treatments aim at increasing dopamine levels. So basically, dopamine can't cross the blood-brain barrier, so it can't be like injected or something like that. But patients can be given levodopa, which is a precursor dopamine that can cross the blood-brain barrier. So the blood-brain barrier is basically between like your peripheral and your central nervous system, and so that can synthesize more dopamine.
Oh yeah, and I like how you like there's like several factors that can play a role in like Parkinson's too. So it's like genes are obviously one of the factors, but it's very rare unless like a lot of your family members have like been diagnosed with like Parkinson's. But and the environment can also have a risk. So exposure to toxins like MPTP, which is found in illegal drugs, pesticides, as well as like well water, can also lead to Parkinson's. And also, like you said about like Lewy bodies too, but then like there's also like a different like part of like the cell, like the mitochondria that has been like altered, has been found in like the brains of a lot of people diagnosed with Parkinson's. So a lot of Parkinson's patients have like cells in their brains that have altered mitochondria.
Okay, that's interesting.
Yeah.
Okay, so the next disease we're going to be talking about is Huntington's, and this basically affects your movement, thinking, and mood. And this is a hereditary neurodegenerative disorder, and it is autosomal dominant. And it's basically caused by a mutation in the Huntington gene when there's too many CAG, like nucleotide sequence repeats. A healthy one has like less than 27, but in someone with Huntington's disease, there are more than 35 repeats.
Yeah, so Huntington's disease basically causes neurons in our brains to decay over time. So this affects movements, thinking ability, and our mental health. And this disease is rare because it's often passed down through changed gene from a parent. So if one of your parents has a copy of the gene, you're like somehow like somewhat likely to have it.
Because it's also autosomal dominant.
Yeah,
so.
Right. And symptoms usually begin in your 30s or 40s, but it can develop at any time. And people with like Huntington's disease that develops like early, their symptoms can be different, and they can also have a faster progression of their symptoms. So the symptoms usually vary greatly, but usually they're characterized by movement disorders, mental health conditions, and trouble with thinking and planning. So the movement disorders, there's something called chorea, which is involuntary movement, and this can also affect the ability to make voluntary movements. So basically, the person with Huntington's can have a lot of involuntary movements, but they're also unable to make voluntary movements. So some cognitive conditions that like people with Huntington's disease face is trouble organizing, prioritizing, or focusing on tasks. And there's also a lack of impulse control, awareness, and flexibility in thought. And some like basic mental health conditions are like depression, because it occurs basically because of damage in your brain and also changes in the way your brain functions. Some other mental health conditions that could be associated with like Huntington's is OCD, mania, and bipolar disorder.
And then for this disease, again, there's like no treatments that can cure it, but some medications can control movement, and like ones for mental health. These ones include like antidepressants or antipsychotics. And then there's also various therapies offered, such as psychotherapy, speech therapy, physical or like occupational, that can help with the symptoms. Okay, so the next disease we're going to be talking about is amyotrophic lateral sclerosis, and it's also called Lou Gehrig's disease in the US, which is basically named after the baseball player who had it. And this is a motor neuron disease characterized by loss of muscle control and also muscle weakening, and it just gets worse over time. So as for symptoms, it often starts in the arms, the feet, or the legs, and you basically lose function in those limbs. And as it progresses, people have trouble walking, speaking, and then even breathing eventually. And so respiratory failure is usually the cause of death. And again, patients typically have like trouble walking with daily activities. They might have muscle cramps and twitching or spasms, as well as like slurred speech and trouble swallowing. And so this disease primarily affects your motor neurons, so it affects the upper and the lower motor neurons. So your upper motor neurons extend from the cerebral cortex and the brainstem down to the spinal cord. And degeneration of these neurons is responsible for your spasms and muscle weakness. And the lower motor neurons extend from the spinal cord to skeletal muscle to cause movement. And this is more responsible for the impaired movements. And as these motor neurons stop working, patients' muscles also atrophy. And then similar to other diseases, there's an accumulation of dysfunctional proteins in neurons, I think there's a link to TDP43, like that type of protein.
Another thing to note is that patients with ALS generally have no pain, and it's not common in later stages even. So, and it doesn't usually affect like their bladder control, their ability to taste, smell, touch, or hear. It's just like their motor functions that have problems.
Okay.
Okay. So next we're going to talk about multiple sclerosis. So this disease is diagnosed by a breakdown of the protective covering of nerves. So the immune system of our body attacks the myelin sheath, which covers our nerve fibers in our brain and our spinal cord. And this basically interrupts the communication between our brain and the rest of our bodies. And this can eventually cause permanent damage of our nerve fibers. So the main symptoms are like numbness, weakness, trouble walking, vision changes, etc. And the symptoms usually depends on the person, the location of like our nerve damage in the nervous system, and the severity of the damage. So some people they lose their ability to walk or move, and others also have periods between attacks with no symptoms, and these periods are called remission. So there's like multiple different types of multiple sclerosis. Talk about that.
Yeah, I think you. Oh, I didn't write them down though.
Oh. Wait, so the first one is the relapsing remitting multiple sclerosis, so MS. So most people with multiple sclerosis has this. So this is when there's periods of new symptoms that arise and period that relapses over like days or weeks. And they sometimes improve partially or completely. But then the relapses are often followed by quiet periods of disease remission. So that's when the periods between the attacks with no symptom.
Yeah.
And then there's also the secondary progressive MS. So usually 20 to 40% of people with relapsing remitting MS eventually develop a steady progression of symptoms. So the progression comes with or without remission and usually happens within 10 to 40 years of disease onset. So the worsening of symptoms include troubles with mobility and walking. And so the final category is the primary progressive MS. And this is when some people experience steady progression of symptoms without relapses. Also some general like symptoms is that there's like numbness or tingling, an electric shock sensation, a lack of coordination, weakness, vision issues, fatigue, mood changes, trouble with memory, and slurred speech. And again, like this depends on like which areas of like your nerve fibers are affected.
And also, like, interestingly, you can see evidence of like damage in MRI scans of patients with multiple sclerosis. So you'll basically see like white areas in the brain, which are basically the plaques. And then the cause of this disease is unknown, but it might involve some sort of excessive like immune activation. Again, it's an autoimmune disease. And as for treatments, so treatments for MS attacks include corticosteroids, and these reduce nerve inflammation, so there's basically less swelling and it helps your nerves work better. And then there's also something called plasmapheresis. Basically, your blood is separated into cells and plasma, and the plasma is thrown away, but then the cells are combined with this like fluid replacement, and it's reinserted into your body. And then again, there's like different types of MS. So disease modifying treatments, these are mainly for like the relapsing remitting MS. And so there's like a lot of different treatments, but there's like injectable ones, oral and infusion medicines. And then of course there's also therapy to help with these symptoms.
Okay, so lastly we're going to talk about the prion disease.
Yeah, and then prion diseases are basically caused by some sort of protein misfolding, and these are fatal. So like,
well, all of these are fatal. So
okay, well,
this is faster. Like a faster progression.
Most people don't survive more than a year,
right?
And so yeah.
Okay, so it's like a bit of context. Like I saw this like on TikTok, and like basically it was like this like full of comments of like nurses being like, oh, like the worst like disease they've ever saw was like prion disease. So that's like some kind of like morbid undertone to it, which I can see why. Okay, so
was it a specific which type of prion?
There's only one. There's just like prion disease. Period. I think it's like I don't know.
Oh, I think the most common prion disease is Creutzfeldt-Jakob disease.
Wow.
Yeah, actually.
Did you just remember that, or did you write it down?
No, I just remember.
Wow. Wow. Okay, let's get into it. So prion disease is rare. It can affect both humans and animals. I think I saw like videos on TikTok of like animals with prion disease, and that just it was not good. I saw a deer with like prion disease, so yeah.
Oh, does it affect their like outward
Yeah.
appearance too?
Yeah.
Oh, okay.
Yeah. Okay. Or maybe it just like moved funny, but like I don't know. It's just like a lot of physical like
Oh, physical symptoms.
you can like
okay.
see it like physical, yeah. So prion disease is when normal proteins in our brain turns into abnormal proteins called prions, and this can cause brain damage that leads to dementia. And like I said, like you said also, prion disease develops suddenly and it also worsens really quickly. And this is a terminal illness, like the healthcare providers that deal with this usually just focus on managing the symptoms.
Mhm.
So a lot of there's a lot of causes for prion disease. So it can be inherited through genetic mutation. So this is called familial prion disease. You can get it from being infected. So this is acquired prion disease, and this happens if people are exposed to contaminated food or medical equipment. And I saw like this video on TikTok again of like the nurses like burn, like they just like took like the surgical equipment of like they operated on like this patient with prion disease, and they just like threw it into like a furnace.
Yeah.
So like obviously like if you don't want to be infected by prion disease, like these are like these steps that you have to take to make sure that no one suffers from like contamination. But being infected is like the least common way to develop this condition. An interesting fact is this disease called Kuru, I think, was the first transmissible neurodegenerative disorder to be identified and studied, and it occurred in Papua New Guinea. And it was believed to be transmitted through ritual cannibalism.
Cannibalism?
Yeah, so basically, I think what happened is like, you know how like, it's like basically a protein like mutation or like abnormal proteins in your brain. So when you like eat it, I guess you get infected through
that makes sense. And also like infection is like so important. That's why it's like so important to clean medical equipment, because that reminds me, I saw this on TikTok, but like
TikTok.
Yeah, there's a lot of TikTok
information. Yeah.
But okay, it was a long time ago.
Right.
But basically this girl, like she had to be like hospitalized, and then she's basically impaired for life because like the doctor, you know, like the IV thing you do for like blood.
Yeah.
Did you see that? Like they didn't clean the equipment before they inserted it into her arm.
Right.
And that actually like scared me, and I felt so bad for her because that's actually that was definitely like the medical practitioner's like fault, because that's actually crazy. Like it ruined her whole life basically. Yeah, that was sad.
Okay. More bad news is that even if you like didn't inherit this genetic mutation, or even if you weren't infected, it typically happens even without like any of the reasons that I just mentioned. So this is called sporadic prion disease. So this is when like the normal proteins in our brain turns into prions for no known reason. So that's bad news.
It's like a spontaneous combustion type of thing.
Like it's just like a mutation.
Yeah.
You know like how like it's like when like the AP biology is gone, but like you know how when they translate like the thing to protein.
Oh yeah.
Like just like random mutations, like this is what happens. So yeah. Okay, so prion disease starts when I mentioned before, normal prion protein turns into an abnormal misordered form called prions.
Yeah.
And so these abnormal prions, like they basically clump together or bind with a normal prion to make more prions. And over time, these prions damage or destroy nerve cells and you lose your brain function. So the symptoms depend on the specific disease and how it affects your brain. But common symptoms include difficulty speaking, moving, insomnia, memory loss, and personality changes. So to diagnose anyone with prion disease, there's multiple tests. But if you have the genetic mutation or you think you do have it, you're tested for biomarkers. So biomarkers are substances in your blood or cerebrospinal fluid that indicates damage or disease. And so I think you diagnose it with like a blood test or like lumbar puncture. So your blood or your cerebrospinal fluid. And a brain MRI shows you like images, so like the providers can look for signs of this disease. And EEG basically measures your brain activity. So if there's like any damage to your brain, you're able to find it through like abnormal brain activity. And the treatment, again, there's no treatment, but to manage the symptoms, the patients are usually given anti-seizure medication for muscle twitch or opioids for pain.
Wait, are the symptoms different in animals? Like, I'm actually curious. Like, how?
I don't think so. I think it affects your movement.
Yeah, right. Yeah. So it's like, is it harder for them to?
I mean, you can measure like memory loss for the
Yeah,
animal,
that's
but
true.
like I guess you can like see that they have like difficulty like moving, like how they're usually. I mean, like the deer I saw had difficulty moving, so I'm just gonna assume that that's what happened.
Okay, yeah, that's definitely very sad.
Yeah. Okay. So that's a wrap. We're done.
Yeah, that's a wrap for today's episode.
Right. So don't forget to check us out on YouTube, Instagram,
Spotify,
TikTok, Spotify.
Yeah.
Yeah. And we'll see you next
in the next episode.
Right. Bye.
Bye.